Thank you. Lane, if you can keep your eye on the weight room for me, please. I'm going to close that box. I'm Jody West. I'm going to share the PowerPoint. Oops, sorry. Let me get it back up. I am the coordinator of the ECHO. I am also the program manager of the provider to provider consultation line, and that is the program that provides this ECHO series. I'm so glad everyone joined us today because this is a new ECHO series for us. Just quickly, I'm going to go through, once I get the PowerPoint up, I'm going to go through the agenda that we're going to have. Is that good? We can see it. Thumbs up. Is that the right? You see my slides? Okay. So welcome to our ECHO. This is the agenda. It goes by pretty quickly, so we're just going to spend a few moments on introductions. Like I said, my name is Jody West, and I'm a social worker, but on the hub team, I am the coordinator. So I'm just coordinating all of the bits and pieces that go along into running this program. Just to tell everyone a little bit about the provider to provider consultation line before we get started. If you scan this QR code, it'll bring you to our website, but we provide mental health consultation to providers across the state of Louisiana. It's free consultation about mental health for either their pediatric patients, which is 0 to 21, or perinatal patients. So the idea is it's a workforce development program that non-mental health trained professionals can contact us, speak to a mental health professional, and get connected to a psychiatrist that specializes in either pediatrics or perinatal should they need to discuss further care for their patient. The idea is we know that there is not enough mental health providers that accept Medicaid, that are specialized in the amount of treatment or the type of treatments that may be necessary if they're very young or during the perinatal period. So this is a way for us to walk and help providers through starting intervention in their primary care setting or in their OB practice. So while they're on a wait list to get connected to mental health services. So that's a little bit about PPCL. You can always reach out to us after this, but I'm going to turn it over to Dr. Olivier, who is our facilitator, to run us through introductions in the beginning of the presentations.
Hey, good morning, everybody. Thank y'all for giving us your lunch break and joining us. Like Jody said, this is a brand new ECHO session. We've been doing the pediatric behavioral health for over a year now. And so it's exciting to be able to do perinatal mental health as well. I'm Dr. Olivier. I'm a child, adolescent, and adult psychiatrist here in Lafayette, Louisiana. I have a private practice here called Bloom Mental Wellness. And I'm the facilitator for this team. And so I keep us on time and make sure we stick to the schedule. I'm going to run quickly and ask the hub team of experts to introduce themselves. You met Jody West, who is our program coordinator and manager. Katie Hebert, you want to introduce yourself?
Sure. I'm Katie Hebert. I am also in private practice at Bloom Mental Wellness, and my population that I serve is the perinatal population. So I'm really excited about this series. And I am a PMHC, which is just perinatal mental health certified. On top of that, I'm a social worker, and I'm glad to be here.
All right. Thanks, Katie. Dr. Finelli?
Hi, everyone. I'm Juliana Finelli. I'm also a child psychiatrist and an adult psychiatrist. My clinical focus is early childhood psychiatry and perinatal psychiatry. And I work as one of the psychiatric consultants for PPCL, for our perinatal component of the program. I work at Tulane School of Medicine, so I'm located in the New Orleans area. It's good to see everyone.
Thank you. And also on our hub team is Dr. Paula Zena. She is our nurse specialist on our team, but she is out today. So just so you know, in future sessions, you'll see her as part of the hub team. We also have a couple of behind the scenes technical assistants. Lena, you want to introduce yourself?
Sure. Hi, everybody. My name's Lena Reggett. I am an LCSW and also one of the mental health consultants for PPCL. And I'm just in the background making sure everything runs smoothly.
And so also Sienna, you want to introduce yourself too?
Hi, I'm Sienna Nakos Caldwell, and I'm also a mental health consultant for the PPCL team, and we'll be doing TA and technical assistance for the ECHO.
All right, thank y'all. So you'll see them on all future sessions until Lena goes out on maternity leave. There you go. Speaking of perinatal mental health. But today we can go right in. Usually we'll start these sessions after introductions. We'll go right into a didactic presentation for about the next 15 to 20 minutes. There'll be a little bit of time afterwards to ask questions, and then we'll go into a case presentation. So today I'm going to talk about, just introduce you to what is ECHO, what is this program, what are we doing here? So ECHO actually, the project ECHO started over 20 years ago. It was about 21 years ago now in New Mexico. And it was a doctor there, Dr. Aurora. He is a gastroenterologist specialist over with the University of New Mexico. And what was going on in New Mexico at the time, over 20 years ago, was that patients were being diagnosed with hepatitis C all over the state. And they were waiting and waiting and waiting to get in to see him as a specialist. And any GI specialist, the waiting list was almost a year long. And so hepatitis C is a treatable disease, but these patients were waiting so long to receive treatment that they were actually passing away and dying before they could receive treatment, before they could ever see a specialist. And so Dr. Aurora said, we have to do better. There's got to be some way I can impart my knowledge as an expert to rural healthcare providers to improve outcomes for these people living in communities, and to help them not have to travel to receive treatment. And so this is what birthed Project ECHO. Next slide. So Project ECHO. So ECHO itself stands for the Extension for Community Healthcare Outcomes. And it's a movement to demonopolize knowledge and amplify the capacity to provide best practice care for underserved people all over the world. So the model connects primary care providers and specialists, primary care providers all over rural regions, all over the nation, all over the state of Louisiana in our case, and connects them with specialists and helps to educate them so that they can be more comfortable treating these specialty kind of disorders or conditions. Next slide, sorry. So how did we learn? What is ECHO? What are these sessions? How are they modeled? So back in my medical training, how did we learn? And we learned through didactic presentations and through cases and actual patient care. And so that's what these ECHO sessions model. So you're going to get a little bit of didactic, a little bit of lecture training, and then you're also going to get a case presentation. So a real life case with an actual patient, not with an actual patient, about an actual patient. And we're going to discuss it. And so these sessions are designed to be very interactive and very, you help me learn, I'm going to help you learn, and we're going to talk through the cases. It's not confrontational. It's very, laid back. Let's educate each other and work together to help improve outcomes. So you'll hear us talk about the hub team. So we're the hub team of experts. You got 2 psychiatrists, you got a few social workers, and you'll have a nurse expert here on out. And we're your hub team, and you are our spoke participants. So it's a spoke and wheel model. We always encourage our spoke participants to join right in and start interacting with us right away. So don't be shy at all whenever we get to that case presentation. Next slide. So how is ECHO different from telemedicine? So telemedicine is a one-to-one model. You have one provider talking to one patient. You're not really increasing your capacity to see patients, it's one-to-one, whereas TeleECHO is designed to amplify care. So you have an expert hub team with their spoke team of learners. And the idea is that you can amplify care and that you'll have the capacity and knowledge to treat more specialty cases of patients rather than that one-to-one, just the one-to-one learning. The ECHO model uses an ABC, as we like our ABCs in mental health care. It uses technology to leverage scarce resources. So we're using Zoom. The whole ecosystem around the world uses the Zoom platform for this. We're sharing best practices. So the information shared in the didactics and when we discuss the case presentations is evidence-based practice coming from experts. We use case-based learning to master complexity. So these are real life cases. And we also encourage you guys to present those cases too, or if you have an interesting case in the future to present those cases. And then There is a web-based database to monitor outcomes. So this is ECHO itself is an evidence-based model, and we want to maintain fidelity and integrity to that model. And so we are constantly learning. So at the end of this presentation, you're going to get a feedback form. We read all those feedback forms. We take it seriously. We make modifications as we go in real time and actively, so that we can figure out the best way to help you learn, help retain the information. Next slide. So why does it work? So you're modeling the way you learn back in your training, and the whole other purpose of this is also to network too, to networking with providers. And so along the way, we'll see, you can come back for more sessions, you can join other programs. So I've seen some faces in this one from the Pediatric Behavioral Health ECHO that have joined our prenatal mental health ECHO. And it's nice to see, like, we look through the chat and see where all of you guys are from. And I saw Abbeville represented, so welcome. So we'd like to reach those rural areas of Louisiana, and we want to network all together to improve mental health care outcomes in Louisiana. Next slide. And how do we use this? So we can use this for prevention, we can use this for screening, and we can use this for treatment. I find that the Pediatric Behavioral Health ECHO sessions were more designed for screening and treatment. Prevention topics do come up a lot, but I think in mental health care, we're talking a lot about treatment. And every so often we'll talk about like screening tools and resources. Next slide. Where ECHO is used. I know this map is actually outdated from 2 years ago when I made this PowerPoint, but it's used all over the world now. They're doing ECHO sessions in India, in places in Africa. There's a huge push to treat tuberculosis in very rural, underserved, or rural countries. And so they're using ECHO all over the world at this point. Next slide. And so again, the whole purpose of it is to amplify care, to reach more patients, to reach these rural areas, and so that the patients in these rural areas and communities receive the same care that they would get if they were in a busier area or an academic teaching center. Next slide. So how are the ECHO sessions structured? So the basic, we call these tele-ECHO sessions, or just the ECHO sessions. They're regularly scheduled video conferencing sessions, which include subject matter experts, your hub team, and learners, which are our spoke participants. And we use the ECHO model. Again, we're trying to create a learning loop here. So you teach us, we teach you. So it's very interactive. The didactic portion is not so interactive, it's just me talking, but the case presentation, like I said, we encourage you to get talking, get asking questions. If you need, there's time to get clarifying questions, there's time to come up with, to discuss recommendations. So it's a very interactive learning loop. We're sharing knowledge between experts and the community partners through active participation. We have a tele-ECHO session once a month. For perinatal, it is the 4th. Jody's saying, yeah, for the 4th Tuesday of each month. So after this one, y'all come on back next month too. All right. And then this is how the sessions are structured. Again, it is to the minute. So my job as the facilitator to make sure we stay on time, and I am checking in my clock. Even as I talk, I'm checking my clock. You'll see my name a lot on here, but that's not the case. That's just because it's the first session and I'm introducing you to the model. But typically we'll have someone present the didactic and someone else present the case presentation. We usually try and get one of the experts to present the didactics. And I'll warn you, not always, most times the didactic does not match up with the case presentation. So we'll have a didactic on perinatal anxiety. We might not have a case on perinatal anxiety, but that's okay. That's just how it goes. It is nice when the two match up, but they don't always match up. And a reminder, we are staying to this structure because we're maintaining fidelity to the model that is evidence-based itself. So the name of the grant, this project is funded through a grant in the state of Louisiana. It's under the Well Ahead grant. But that PPCL that you see, that's the provider to provider call line. And so Well Ahead Louisiana PPCL will serve as the hub of specialists. And we already talked about the psychiatrist, the nurse, and 2 social workers. Our nurse is also a psychologist as well. So we got strong experts in this field. but you can call that line at any time and consult with us or consult with a hub team on those cases that you have out in the community, which is a nice benefit of being part of this program. In addition to the free CMEs and CEUs that you get from being part of this program. So beginning in March, sessions will be held. It's actually every fourth Tuesday of the month from 12 to 1 p.m. And it's free CEUs as long as you fill out the survey at the end of it. So we kind of introduce ourselves in these ECHO roles. You will see overlap in these roles. So I'm a facilitator, but I'm also an expert as part of the hub team. Jody is the program coordinator, but she's also an expert too, a social worker in perinatal mental health. And you're going to see, you met our IT support staff, you met the subject matter experts, Dr. Finelli, Katie Hebert, and then Dr. Zena in future sessions, and then me as your facilitator. So we will be in every session with you guys. This is for our pictures for future reference. And then just a note on case presentations. When you volunteer to present a case, we like to get all the information from you about 11 days ahead. It's a form that you'll fill out, and Jody West is going to guide you through that whole process. She'll make sure that you turn it in on time, and we review the cases beforehand just to make sure protected health information is not disclosed. So if you say the name of a school or the name or something comes up where we think that something identifiable about the case, we'll have you revise it prior to. So there's enough time to do that. And then we review those cases, and we like to have a kind of an idea of what we're going to discuss so that it's the most productive for you guys when we come. Again, you get CEU, you get continuing education units for sessions. Everybody can, from physicians, social workers, therapists, counselors, on down. All right. It's like we're going right into the questions. No, we encourage you to be honest on the feedback, because we do take it seriously. We read all the feedback and we make modifications as we go from session to session, even if we're in the middle, to make things better and to make it most productive for you. All right. Any questions about the ECHO model? All right, y'all. I'm gonna let Katie Hebert.
So thank you all for attending. Thank you to Dr. Olivier and for Katie for presenting this first session. We're going to put in the chat a link for the survey, and I'm also going to email it so that if you are interested in claiming CEUs or CME credits, you have 48 hours from today, from right now, to complete it or it'll close. It is 1 hour of clinical content for the mental health professionals. Our next session is scheduled for Tuesday, March 26th. We do need a case presenter. And again, we're going to walk you through all of those steps. So please consider signing up. We can send a link to you. But in the meantime, if any cases do come up that instead of waiting, if you need consultation, a lot like this, where we get information from you, discuss the case, if you need to connect, if you're a prescriber or if you have questions about treatment, we can connect to psychiatrists, social worker, resource specialists at PPCL. So we appreciate everybody's attendance today. I'm so grateful that you spent this time with us, and I look forward to hopefully you participating and joining us through the next 9-10 months. So thank you all for your time. We'll stay on if there's any additional questions, but have a good afternoon. Okay. Thank you.
Thank y'all.